Hello, I am Dr. Shin Jae Kim from Cheongdam Wooridul Spine Hospital. The topic I will discuss today is CTL MRI. CTL stands for cervical, thoracic, and lumbar. It is to scan the entire spine. We often scan only the lumbar spine, the most common cause of leg or back pain. However, when your legs hurt, the nerves involved run from the brain through the neck thoracic spine and lumbar spine. Pressure on a nerve in the cervical or thoracic spine, which might be missed if only a lumbar MRI is done, can cause leg pain. While it is essential to check the lumbar spine first, symptoms can also arise from issues in the thoracic or cervical spine. Therefore, it's important to differentiate these areas as well. In fact, at Wooridul Spine Hospital, while taking a lumbar MRI, we also take a CTL MRI that can observe the sagittal plane of the thoracic and cervical spine. There are many cases where unexpected lesions are discovered because the cervical spine or the thoracic spine has also degenerated, rather than only the lumbar spine. If lesions in the thoracic or cervical spine are missed, treating only the lumbar spine might not relieve symptoms. Often, additional imaging of the thoracic spine is needed later to make a proper diagnosis. This test, called CTL MRI, can be a very important test in order to be able to accurately identify the cause from the beginning. I would like to introduce you to just a few patients who I have actually checked for other lesions using CTL MRI. In reality, there are more cases where degeneration is found in other lesions than you might think. So, if you look at the first case, this person came because of leg weakness. The patient had weakness in both legs and arms, which often indicates a lesion in the neck. So, I took an MRI of the patient's neck and found out there was a lesion in the cervical spines 5 and 6, where the disc had bulged out so badly that the color of the nerves had changed. I reviewed the patient's CTL MRI. There was no significant nerve compression in the thoracic spine, but there was compression on the lumbar nerves as the disc between the 4th and 5th lumbar spines degenerated and protruded. If symptoms like leg numbness or lower extremity pain persist after treating the neck, it suggests a possible lesion in the lumbar spine that may need treatment later. If numbness or pain in the lower leg persists after neck treatment, it suggests a possible lesion in the lumbar spine that may also need treatment later. This person also had a CTL MRI. The image revealed ossification of the ligamentum flavum in the 3rd and 4th thoracic spines, which is not easily seen on a standard lumbar MRI. Nerves from the thoracic spine to the lumbar spine can cause lower extremity symptoms if compressed. Ossification of the ligamentum flavum can lead to specific symptoms, like feeling discomfort underfoot. Treating this area improved the patient's symptoms significantly. Usually, it is correct to take scans of the area where we have symptoms. When examining an MRI, a sagittal view alone isn't enough for an accurate diagnosis. Cross-sectional images are also needed to properly assess the condition. Examining all cross-sections of the waist, neck, and back together increases examination time and costs up to 3 times more than a regular MRI, which can be a significant burden for patients. For CTL MRI, cross-sectional images aren't taken. Abnormalities in the cervical or thoracic spine are assessed through the sagittal plane. If the initial CTL MRI shows abnormalities, a separate cross-sectional image may be taken for a detailed examination of that area. Get a back MRI first for back issues. However, consider a CTL MRI to differentiate lesions that may have similar causes in other areas. The CTL test provides a complete view of the spine or distinguishes lesions in other areas. It helps ensure we don't miss any potential issues across the spine. There are quite a few cases where abnormalities occur in other spines. When one part of our spine is out of balance, it affects the entire spine. Prolonged issues in one area, such as a bad back, often lead to severe degeneration in other parts like the neck. In these cases, it is necessary to check for overall spinal lesions. Therefore, the CTL test is essential in reducing the misdiagnosis rate and accurately diagnosing and treating these patients. Through this CTL MRI test, which is frequently performed at Wooridul Spine Hospital, I hope that various lesions on the spine that may be missed can be accurately diagnosed and treated well. Thank you.